Hello, this is Dr. Aditya Kulkarni. I am a consultant neurologist at Manipal Hospital Sarjapur Road. Today I am here to discuss about the importance of early treatment of acute ischemic stroke. So we will start with the symptoms. You should remember, one is slurring of speech, drooping of face, drooping of arm. So we can make a short form as FAS, that is face drooping or facial weakness, then arm weakness and slurring of speech. If you come across any person in the family or your surrounding or at your workplace who has one of these symptoms, you should identify it as a maybe suspected stroke and bring such a patient, such a person to the attention of nearby hospital. This is important because if it is truly a stroke, then it's an emergency, it's a neurological emergency, and time is very important in this scenario with respect to treatment. So one modality of treatment which is called reperfusion treatment, it is aimed at making the blood flow to the brain again, re-establishing the blood flow to the brain in a normal way, so that all the symptoms will recover completely as soon as the treatment is initiated. So how the stroke happens? So there are two mechanisms. One is stopping of the blood flow to the brain area, giving rise to damage in the brain area, which is called as ischemic stroke. If this is a scenario, then one modality which is called as a IV thrombolysis is achieved by giving an injection in the vein of the patient, and this can be given only within 4.5 hours from the onset of symptoms, roughly. Sometimes it may be extended to 6 hours or maybe beyond that, depending on the imaging parameters. So how this works is, the drug will break the thrombus or clot in the artery, so that the blood flow to the brain area is again re-established, and the part of the brain which is not irreversibly damaged will recover its functions very immediately on the next moment, and such that the symptoms of the stroke are completely recovered or maybe almost nearly recovered. This is how the patients get benefited if they are brought to the emergency room soon after the symptoms are recognized. So how it happens is, there is something called as a penumbra, ischemic penumbra in the brain, where the tissues are not completely irreversibly damaged, but they are not viable. That area lies in between the healthy brain tissue and the infarct core, which is the irreversibly damaged area of the infarct. So as time goes on, the ischemic penumbra goes on reducing and the infarct core goes on increasing in the volume. So at a stage when, say, 8 or 10 hours after the stroke, if the entire penumbra is already vanished and there is no window of opportunity of treatment available after which the patient may recover. So that is why the golden hour is important. The golden hour means is roughly around 4.5 hours from the stroke onset. The modalities for acute stroke care, they require, first thing is the ability to administer the drug. Before that, the ability to do at least a CT scan of the brain and if required MRI of the brain, and to administer the drug and then monitor the patient in the hospital for next 24 hours minimum. This is the basic minimum. And in addition, some hospitals, they also have the facility to engage the patient into a cath lab, where by doing some intervention the thrombus is removed mechanically, which is called as a mechanical thrombectomy. So such a hospital which has the facility to quickly diagnose the stroke and then administer the early treatment is called as a stroke ready hospital. In order to achieve best outcomes in stroke and to minimize long-term disability, it is highly important that a patient is immediately taken to a stroke ready hospital. Thank you.